Mariano. I'll invite you to take a seat, and I'll ask Jane to come back here and join us for the discussion, for the Q&A. But Mariano's also asked me to invite his colleague to join us. So Nihaya Daoud. Nihaya, are you there? Yes, you're at the back there. So please come and join us. Yes, take the seat there next to Jane. And welcome, and thanks for joining us for this discussion. So, questions from the room to start with, because it's important to give you the floor first. Yes, we have the lady there, and yes, we'll start.
Yes, hi. I have a question for Jane. In a lot of the work that we do, we want to influence want to influence policy. And in your work on gender-based violence, you seem pretty adamant that policies could actually help with gender violence. So I'm just wondering if you could give us some examples. Yeah.
Does that work?
Yes.
You can hear me. Yeah, I mean, we really do. And actually, just as anecdotally, earlier today, before I came, we had a meeting with one of the deputies in the French National Assembly, because France is currently debating a new immigration and asylum law, and we think it's important, really, and that's what we're trying to do, to have input into these policies and legislation. So one of the things, for example, I talked about accommodation, and we found across many countries that that's really a key to, a key risk for gender-based violence. There were so many women who, I'll talk about the example of France, but women who arrive seeking, as refugees, and they arrive and they find themselves sleeping on the street because there's no accommodation for them. There's not enough accommodation for asylum seekers and refugees. And they have like an emergency hotline that they can call. But that line, if you call, it's like the SAMU, which is for anyone who's homeless. You can call this line to try and get but you have to call and you don't get a reply. And then we had cases of, women who did eventually get through, and they said, oh no, we haven't got anything for you. And they were sleeping on the street with their children. One woman was really pregnant, and they said she got through, and they said, "Oh, you have to fax us a proof of your pregnancy." Imagine somebody sleeping on the street, and you get through on a phone line, and they say, "Fax us a proof of your pregnancy if you want us to find you a space." And she eventually, with the help of an association, she did that. But even then, she had to wait another 3 weeks. And then they get places in these, because there aren't enough accommodation. Often it's in private hotels, which are really also dirty. They have no cooking space, so they might be in their room with children and family. They have nowhere to cook. There are lots of cases actually of violence within those hotels because they're run by private people. There's no privacy. People come and open the doors all the time. So that's one, really practical thing. Just provide accommodation and decent accommodation for these people who are coming to seek protection and seek refuge. And one striking thing was the contrast which is why I think we really need to think about this in an intersectional way, was the contrast with the response to Ukrainian refugees. And as soon as Ukrainian refugees arrived, there was accommodation for them. So it's not an impossibility. It's not that the accommodation isn't there. It's like state and policy don't want to provide it. So that's one, very clear thing that we thought about. There's also issues for example, relating to, if a woman wants to report her husband, report domestic violence, and she feels like she's dependent on her husband's legal status. So there's a real need for policy and law, and also policy, to ensure that migrant women whose partners are violent, don't lose their legal status. And in some countries there is that law, but it's not implemented, or it might be that it really is dependent on your local police station. So if you go to your local police station and they are interpreting the law in a nice way, then they might, help you to get a paper. But often, women find themselves undocumented because they report violence from their partner and they lose their migration status. So all of those things, which are practical questions where either there is law and it's not properly implemented, or the law needs to change. But all of those things can change, and it would have a really, really big impact. So, and I've got other examples, but I'm not going to go on for too long to.
Thank you. We had a question from Bilkis.
Yes. Thank you. I have two quick questions, one for Jen and one for
Mariano.
Mariano. Thank you. So about the gender-based violence, I had a chance to talk to some of your co-researchers. So what I'd like to hear from you is the acronym GBV, gender-based violence, that you've been using, of course. And did you ask yourselves how to unravel what you're calling GBV in terms of particular, I mean, you mentioned FGM, you mentioned honor-based crime, honor-based sort of, I guess it's obviously killing at some point, or forced marriages, but those kinds of examples, they happened quite often, or is that what you put under GBV, or there's a whole continuum of just being, it is important to account for a wide variety of how people feel when they're harassed to some extent. Do they have to go to the hospital once they're violented, I guess, attacked, or what kind of scales have you used to categorize, and who is more exposed? And I appreciate that at the end you were talking about migrant and refugee, but then migrant, it's a whole big community of women, some with privilege, some not. So I was just wondering, how did you unravel all these sort of big categories of sort of people that you were sharing with us? And then the other one was afterwards for Mariano, if you want to answer. But for Mariano, I just wanted to congratulate you, because your work has been an inspiration for a lot of our students in Canada, and especially using your model and your approach to a student who works in the République du Congo. And she has applied, and I think you gave me some of your papers, and so that was really nice. And it's really appreciated, because positive masculinity is a whole big issue in some of the countries of Africa. And maybe you can talk to us about the replicability of the work you do in the global north, and how does that resound in the global south, if I may express myself that way. Thank you.
Okay, so Jane.
That was a lot of questions, and yeah. No, it's just that we did debate all of these things at great length. In terms of the category, I talked about migrants and refugees, and we had a long discussion about how we talk about people, because there's a huge debate in research about categorization and a pushback against categorization. So in other, we can talk about people on the move, we can talk about illegalized people on the move. We wanted to break down, we weren't sticking to the categorization of legal categorization of refugees versus economic migrants, because we feel that's very, very political and politicized. At the same time, clearly, migrants. I'm a migrant because I'm originally from the UK and I live in Paris. So, and I'm a privileged migrant, and I'm not in the same situation. So we were looking at people who had crossed international borders and who were in situations of precarity, economic, legal, political precarity, so not privileged migration. But we did have a long discussion, and we have written about that, and we've written about the need to break down categorizations, talking about people on the move in this way. In terms of, I can talk more about it, but I won't be too long. In terms of gender-based violence, we were considering all violence which is committed against someone because of their their identification, their gendered identification. So yeah, we have a wide range of violence. It includes physical violence, but also psychological violence. We're looking at the continuum. We use the idea of continuum of violence, which comes from researchers like Liz Kelly, to talk about what we mean by gender-based violence. When I gave the example of FGM, I was giving that because I think it's interesting that that's something which is often really fixated on. And that's why I was talking about the culturalist understanding of violence, because all these other forms of violence are just really ignored. And when you talk to, France, other EU countries have this big violence against women policy or gender-based violence policy. And then when you say, well, what about in terms of migration, in the context of migration, then they'll say to you, oh, yeah, we have something on FGM, or we have something on forced marriage. And it really is a hugely culturalist way of understanding something which is, you know, a continuum, which is a large phenomenon and which encompasses a huge different kinds of range of violence.
Sorry, you need the mic. I'm sorry.
Just a quick remark. Thank you so much. But did you then do you conclude that lack of accommodation equal gender-based violence?
We could
Because
conclude
you just said that, you know, I don't really think that FGM, you know, is an issue. They should talk about accommodation.
No, I didn't say I didn't think it was an issue. I just that's not what I said. I don't think it is I don't think it's not an issue, but I think it's a problem that when you say to somebody, we're doing research on gender-based violence in the context of migration, the first thing or the only thing they want to talk about is FGM, and they don't want to talk about all of the other forms of violence, and they don't want to talk about the way in which their policies actually cause violence. So that's, I'm not denying FGM is an issue, but I'm just saying it's an issue that is the one thing that people talk about when they talk about migrant women. It's racist and it's culturalist, and it's a way of just diverting attention from the fact that all their policies are pushing people into situations where they experience multiple forms of violence and multiple forms of not their rights being completely ignored. So,
I'm sorry.
Sorry.
Mariano, can your approach, can your work be replicated, or can it be further spread?
Absolutely, but first I would like to acknowledge that this is not only my work. I think it's the work of our research group, Nihaya, Carmen, and Claire, who are Carmen and Claire. They are not here, but this is a work that we have been doing together. Yeah, and plus a larger team of people, senior and younger as well. I think definitely it can be replicated because we are thinking about the method. We are not thinking about the specific cases. So if you look at our educational material, we say that in a very straightforward way. You know, if these cases don't apply to you, to your setting, change the case. But then the discussion remains the same. So it's the method that can be replicated and that can be adapted if in Congo perhaps the example is not one that is relevant to the environment. But I'm pretty sure they know other cases that apply to their own to their own country, to their own setting, and so on. So that's what we wanted to do to facilitate a method for discussion and challenging of, and especially a method that is based on discussing cases. You know? Because vignette, using vignettes, because that creates discussions and that creates the possibilities of different answers, of different approaches, and discuss them more in depth. But yeah, I think so. It's the method that is important. The content can be changed and adapted to our settings. So that's what we say. See what is relevant for you. If you want to change it. But this is more or less the format that we suggest to do. And it's not the only one. There are others there who may be, who may be better. What do you think, Nihaya?
Thank you, Mariano. I think this is a very important question because actually in our study we were challenged by the different cultures, and countries that participated, where violence is perceived differently among young men and women, and also we found really that it is really constructed, of course, by political forces, socioeconomic status, of course, gender relations. For example, in Israel, I studied, perceptions of violence and masculinity among young Palestinian men and women, and also among Jewish men and women. And there were really huge differences. For example, hegemonic masculinity was really dominated among Jewish men, while compensatory and critical masculinity was more found in Palestinian young men, where they actually related violence to the country violence. So it was really different. Ireland was also different story. Of course, Spain was different. So I think this is the challenge. It's the method, but also understanding the political context, the historical context, the economic context, where intersectionality, of course, is coming. Of course, also policies were very important. I think this is also related to your study. I think if you like to study also policies about immigrants, violence against women and immigrant women, I think it's important to know about the policies in the country about that are trying to minimize or to decrease violence against women, because this will have impact on the general issue of violence against women, and specifically among vulnerable women. In our case, for example, indigeneity was very important because Palestinians are not recognized as an indigenous minority, not internationally and not nationally. So I think this took us really to some different perspective about studying masculinity, about masculinity in a settler colonial state, in masculinity for indigenous young men and women. So this is something that we expect to see, but it was very strongly pronounced in our study. So I think yes, I think the methods we used mixed methods. We used qualitative methods, quantitative methods, and our quantitative methods were actually building on our quantitative. So it was really coming from the participants themselves. I think this is very strong. And I think we still did not finish to analyze everything. We have still lots of data to analyze. I think it will be really very interesting to see that in future publications.
Thank you. Do we have a final question? Yes, please.
Thanks very much. It was really interesting to hear your presentations. I was wondering about, it kind of links back to, in Belgium, kind of meeting or seeing women who are like traumatized or are suffering from PTSD because of violence that and it often isn't linked to female genital mutilation, but to the experience. And this is exactly what you were talking about, the trajectory from their country of origin to Belgium, and having been raped or being in difficult situations, sleeping on the many difficult stories that then leads to trauma or PTSD, and the kind of the reaction that follows, that they don't want to talk about it, or that they go silent or start crying, and the kinds of reactions that make them even more vulnerable in a society where you've got to ask for help and you've got to know where to request help at all these different services. So I was wondering in what ways in in both your projects, to what extent PTSD or trauma was kind of appeared, or how it was, if you've got any specific recommendations specifically relating to trauma. Yeah.
Can I ask you to make a quick answer to that one?
Do you want to go first? Or? Yeah, I mean, it was huge amounts of trauma, and when you know the refugee routes that people take, and the things that they've, sexual violence, horrible violence, also people that had seen their sisters or children drown on, really just things that, and the problem is that there's a lack, in terms of recommendation, there's a huge lack of specific services. So even people, when they do get into an accommodation centre, there aren't specific, there are a few very focused and very migrant or refugee or trauma specific services for those people, but in general they have waiting lists, like huge waiting lists. There's not enough services, and also often they can get relocated around the country. So we were doing research in Paris with one centre, and we talked to psychologists and psychiatrists who were working with people who'd been really traumatized by their violence, and then suddenly they got a letter saying you're going to be sent to like Clermont-Ferrand, I should say, I don't know, somewhere on the far, where those services don't exist. So there's a lack of services, there's a lack of continuity, there's a lack of translators in the services, all of those things, you know, I presume it's probably similar in Belgium, but there's a real lack of those specific devoted services which need to be developed also, I think. Did you want to?
No, I'm thinking that we didn't include migrant populations explicitly in our study, so it's very difficult to say. Although we did interview some migrant men and women, it didn't came out. So what we did found is that there was a frustration from women that reported violence and nothing was done about it. So, and this is something very, very troublesome, especially in Sweden, when we are a very, we are considered a very pro-gender equality society. And this was expressed by the Swedish women that, even if we have the possibility to report violence, then nothing happens. So at the end, why should we report anyway?
Nihaya, maybe in your particular framework of...
Yeah, so mental health was really a major issue that was, related to violence against women in our study, and another study that actually was related to our study. And we found a very interesting phenomena in our study population, our context, that many times the mental health professions are not trained to treat women with violence. Many times they actually are provided with a not precise diagnosis. I don't want to say wrong the diagnosis, because they actually are not trained to diagnose women who are post-traumatized because of violence. So sometimes they are given really a different diagnosis and the wrong diagnosis. And in our context also, the health issues are treated by the Minister of Health, while violence is treated by the Ministry of Social Welfare. I don't know if there are different countries having the same, so the budgets are different, separated for each topic, and the women have to find the services in each of these services and ministries. So it makes the problem more difficult for these women, and so the professionals actually sometimes send women to different services, and because they don't have it in one place. So this is also for the general population and not just for the immigrants. But for our case also, talking about Palestinian women, it's the same issues that were raised here, the language issues, the lack of accessibility, less physicians who can actually are trained to treat these women. So very similar to the case of migrant women. Thank you.
Thank you very much. Thank you to all three of us, of you. There's only three of you. So thanks for this dialogue and for answering the questions so openly. Thank you for your questions.